Okay, I'm gonna do hand hygiene. I'm checking my orders. I've got Steve Rogers, patient of Dr. Strange, and we're gonna be doing a PCA pump that has a basal rate and then also a demand dose. So I've already done one check to pull my med out of the med room, and so I'm gonna come in and I'm gonna educate my patient first. I'm gonna come and say, "Hi Steve, my name's Lily. I'm gonna be your nurse today. Can you tell me your name and date of birth?"
Yep, Steve Rogers, 1225.
Perfect, Steve. So today, I saw in your chart that you're in some pain. So we're gonna give you something that's called a PCA medication administrator. Can I tell you what that is?
Yes.
Perfect. So what it is we're gonna give you some pain medication through your IV. So it's gonna just help go quickly into your body. And we're gonna have two different types. So we're gonna have one that's just continuously flowing into your body. But if you feel like that's not enough, we're gonna have this button right here. And every time you can press it and it'll administer medicine, it'll be green. So you can press that and it'll administer just a couple, like a little bit of extra medicine, but it's not gonna let you overdose or anything. Like it'll have a lockout limit, so you can really press it as many times as you want and it'll only administer a safe amount. So that is that dose. Do you have any questions about that?
No.
Okay, perfect. And then something to be aware of is that no one is allowed to press that button for you because we want to make sure that you're the one in charge of it. So no family members or no one else, it needs to be you. And after we start, if this is your first time having morphine, then I would come and check every 15 minutes to make sure that you're not having any allergic reactions. But if you are having any sweating or swelling or redness or itchiness around your site, then I want you to just let me know, okay?
Perfect.
Perfect. And if not, I'm going to come in every hour and just monitor and see how you're doing and see if we are close to your pain goal or if we need to adjust how much medication you're taking.
Great.
Okay, perfect. So first, I'm just going to check your IV site and make sure that it's patent before we are putting your putting more medication in it. Do you have any allergies?
No.
Okay, great. Perfect. So normally these would have an alcohol cap. Because this doesn't, I'm going to scrub my hub, but normally they would. Just make sure that it's all the way clean. Perfect. Then I'm going to go here. We're going to pull back. I would look to see if I got blood. And then I'm going to go and make sure that it's not infiltrating, which it looks good. So I'm going to lock this. And then I'm going to get my medication. So before I put it in, I'm going to do a check. Just make sure again that this is the correct medication. So this is morphine sulfate. It should be 25 milligrams in 25 milliliters. And then the basal rate says 1 milligram per 1 milliliter. It expires 6/1/2026, so it's not expired. And then I will put in the orders for it. And it is going to be through a PCA pump is the mode. So first I'm going to prime the tubing, which, because we're using this tubing, it might have a hard time actually priming, but we're going to do our best. Great. Normally I would be careful to not waste medication, but because we already have liquid in here, I'm going to push some more through to try to get all of the bubbles out. Okay, good. I'll call that good. Lock it, and then I would put an alcohol cap back on that so that it's staying clean. So I'm going to put this in. Perfect. And then I'm going to connect this so it's not flinging around. We're going to just take that off. And that stays clean because it's just on that. If needed, I could put alcohol wipe or cap on. And then we can attach to that. So now I'm going to program it. So we have our key that we need to put it in. I can push this in front. I'll click around. Close it. I'm going to move it to the program side. And then I'm going to turn this on. so I'm gonna channel select over here, confirm my time of date. I'm gonna select my syringe, confirm. I'm gonna go down to morphine. This is for acute pain. 1 milligram per 1 milliliter. Yes. Before I administered, I would go in and I would do a respiratory check so I could listen to the lung sounds. I would put an O2 monitor on them if needed. I would count their respiratory rate and I would ask them if they're having any trouble breathing. All of that was great, and so I can continue. I'm gonna confirm. Confirm. This is saying to put the O2 monitor on. Perfect. We're gonna do a PCA dose and continue, and then I'm gonna check this with my orders and make sure that it's correct. PCA 0.5 every 15 minutes. Continuous dose is 1. Max is 3. And then I'm gonna have another nurse come in and double check that that is accurate. Okay. 1 milligram per hour, 15 minutes, and 6 milligrams per hour. Okay, perfect. Then I'd have her sign that off so that I have a witness. Now that I feel good that that is done, I can press continue, yes, close. I'm gonna move, lock this. I'll take the key with me, and then I'm gonna trace my line down and make sure that everything is unlocked so that it can flow. So we're gonna open it, and then as this is running, I would just educate my patient one more time and say, okay, I want you to let me know if there is any, if you have any problems with, that if you're starting to feel weird or if you're having a harder time breathing. And again, I'm going to be monitoring you. We've got that O2 monitor on your hand so that we can keep track of that, because that's something that we can see. And then I'll keep coming in, and some of the things that I would document are that I educated you about the difference between a continuous and a basal dose, and then also that I'm going to come in and be monitoring how much of, like how many times you press that button to see if we are treating your pain well enough or if we need to adjust it. Do you have any questions about that?
No.
Okay, then I would do safety times 4, so I'd make sure that your bed is all the way down, your handrails are up, you've got your call light in place, and your wheels are locked. I would perform hand hygiene, and then I would just go document everything that I needed to document. And that's it.